and welcome to this session on government engagement and partnerships for high impact work. Most impactful interventions will struggle to achieve scale without government participation and collaboration. So, if finding the hack to government collaboration is of interest to you, this session is for you. This session will be taken by Dr. Obinna Ebirim. Dr. Obinna Ebirim is a public health professional and health promotion specialist with over a decade of experience spanning clinical practice, health policy, and system strengthening. He has served as a public health specialist and technical advisor to policymakers, leading and supporting initiatives in health worker training, immunization, primary health care system strengthening, conditional cash transfers, advocacy, and campaign. He is the Nigerian country lead at HealthLearn and serves as senior technical advisor on youth health and policy research to the Honorable Minister of Youth Development. He is also co-founder of the IDYL initiative and recently led the demand-side incentives immunization project across Cameroon, DRC, Lesotho, and Nigeria at Corona Management System. A 2016 Mandela Washington Fellow, Dr. Ebirim has held influential roles, including senior advocacy officer at NIEL, national coordinator at New Incentives, and member of Wellcome Trust Infectious Disease Campaign Advisory Group. He served on the board of governors at Robert Gordon University, Scotland. His work bridges health, policy, and youth empowerment across Africa. This session would include a Q&A after the talk, so please send your questions through Swapcard. Just open the session on the app and click the speech bubble to submit your questions. If we don't get through all of them, don't worry, Dr. Obinna will be holding an office hours in Hall 2, exclusive hall, right after this. With applause, please join me in welcoming Dr. Obinna Ebirim for his session on government engagement and partnerships for high impact work.
All right, good afternoon, everyone. Good afternoon. Yes, so this is going to be very fast. So in the next 15 minutes, we're going to explore how to partner and engage government for high impact work. And I'm going to use what we've done at HealthLearn as an example. I'm going to also share some of my experience in this field because I believe that looking at the room, there are two sets of people I can see, founders or people who work in high-impact organizations that want to engage government. We also have students and people who are looking to take up roles around government engagement and partnership. So I will start by telling us what HealthLearn is all about, the work we do, and some of the impacts we've made, and then how we work with government, before then coming into the meat of the discussion, which is how do you effectively engage government and then sustain that partnership. And I just want to put up a caveat here. There are many ways to engage government, right? So I'm going to share the way we use at HealthLearn, but that's not to say that that's the only way to engage government. So I hope that at the end of this, you can pick one or two things about engaging government. So HealthLearn, who are we? So we're a non-profit and we engage in developing and providing free courses for healthcare workers in Nigeria and Uganda. And this is not just your routine or regular health, courses. These courses are made very accessible to them. And how do we do that? We make sure that these courses are short, they are case-based, so they can relate to their day-to-day activities, and they are aligned to the local guidelines. So we work in Nigeria and Uganda, and someone in Uganda can take the course for Nigeria, and the one in Nigeria cannot take the one for Uganda, just to make sure that they are tailored. We have 3 courses at the moment, one on newborn care, one on hypertension, and one on infectious disease control. Now, in terms of accessibility, what we do is that we make sure that even the healthcare worker in the very remote areas of Nigeria or Uganda can access this course. And what do? We make sure that even if you have those very old phones, as far as you can connect to internet, you're able to access the course. And the course is completely free of charge, very short. And we do not teach in these courses very advanced things, just the very simple things you need to know. Why do we do what we do, right? There is a lot of deaths caused by low quality of care. When you go to the PHC or the health facility, the care you get is not up to par. And this could be due to issues around knowledge gap, people don't know, or even knowledge decay. Over time, your knowledge, you've forgotten some of the things you learned in medical school or nursing school, right? So that's the need for people to then be trained and retrained so that they can then improve their knowledge and improve the quality of care services they deliver. So our project targets healthcare workers in primary health care. So I've mentioned about what we do. These courses are simple for facility-based health workers, and they are case-based so that if they are taking the courses, they can relate to their day-to-day. And what we now do is that we ensure that we co-develop this with government, because when it's developed with government, the healthcare workers are more likely to take this course if they are recommended by government. And then we also work with the regulatory authorities to get them accredited so that healthcare workers, in addition to this course being free, they can also get CPD points when they finish this course, which they can use to renew their license. So basically, that's what we do in HealthLearn. Co-develop these courses with government, provide it free of charge to healthcare workers, and make sure that it's accessible to them, irrespective of the type of phone they use, or if they are in places that have low or intermittent internet network. And what are we seeing in terms of the success we are making? Right now, just in Nigeria, we've trained about 15,000 healthcare workers, and this is between February 2024 and now about 17 months or 16 months, right? And it's estimated that this approach can have about 24 times more cost-effective than the cash transfer. So this is really a cost-effective intervention. And last year, we did something. We wanted to check if taking this course would improve clinical practice. So we launched a clinical evaluation where we worked with experienced ENC trainers to apply a tool before and after the healthcare workers take this course. And what we saw was that at baseline, there are some practices that save life, but healthcare workers are not practicing it. Something like skin-to-skin care. You know, when a mother gives birth and you put the baby on the chest, right? That could help increase early initiation of breastfeeding, things like even provide warmth to the baby, right? But most healthcare workers are not doing this. And this is something that I've been taught. So that's an example of skin decay, skills decay. Over time, you forget. So what we saw was that when people eventually take this course, the healthcare workers, it improves their ability to put this into practice and save more lives. So this is some of the successes we are seeing at this point, although we're also planning to do more robust evaluation. But now to the meat of the discussion today. For us to achieve this, we have to work with government at the national level and at the subnational level, the states, right? And these are examples of them. We had to co-develop the courses with the Federal Ministry of Health, the various departments, National Primary Healthcare Development Agency, and then we worked with the Nursing and Midwifery Council and the Community Health Practitioners Board to ensure that these courses are reviewed. So when health workers take this course, they then get the CPD point they need to renew their licenses. But then when it comes to dissemination, for you to disseminate this, you know Nigeria is a place, right? But actually Nigeria is I would say a group of states, right? So anywhere you are in Nigeria is a state, FCT and other states. So we're working with the state primary healthcare development agencies to ensure that they're able to buy this idea, then communicate it to their healthcare workers to take this course. And we're using an approach called light touch, where we don't need to have a staff there. We speak to the states and they adopt this course and they're able to provide internal memo to the healthcare workers. But then how did we engage the government? Now, these are the key steps, and this is not just about whether you're working on the space where we are training healthcare workers. Irrespective of the program you are doing or you want to do, before you start, the first important thing is that you have to understand the context, right? You're coming to a space, be it immunization, family planning, nutrition. You need to do a landscape analysis, a stakeholder mapping, know the right stakeholders. One very big mistake you would make is not knowing the right stakeholders, and you engage one stakeholder and leave the other. It can become very problematic. Or when you go to engage the stakeholders, you don't understand the context and the landscape. and you're not speaking to their priorities or what is important to them, then you begin to have problems even before you start your project. So it's very important. And this is also for those that are looking to careers, opportunities, right? These are areas you can build your expertise, right? On how you can carry out a quick literature review, how you can review policies, documents of government to be able to understand what is the context, how do you map stakeholders, analyze them, understand their power and influence, right? If you have this skill, most high-impact work or charities coming to Nigeria might require your services because they need to do this landscape analysis. They need to map stakeholders before they begin to engage government. The other, haven't done that, the next step is robust stakeholder engagement, right? And this is something that you need to do continuously, right? Continue to engage government. And when you engage them, you need to use the information you got in landscape analysis. When you're meeting someone in government, you need to speak to what is of interest to them. You don't go back and speak only to what is of interest to you. And this engagement must be respectful. There's already a base thought process among government that you are coming in because you have a lot of money, you're coming in because you have a lot of knowledge, right? So you must be intentional about how to remove that perception. Make sure you intentionally make them understand the power they have, that they understand the context more, that they want setting the policies and guidelines, and you're here to support them. And you also would want to gain from their wealth of experience doing this over and over and also setting the policy. So this is something you need to know. And then there's something about those building their career in this space. Some of the things that have helped me in government engagement is relationship management, right? Some of the things you're doing here, meeting people, getting their numbers, please keep in touch. And when you start engaging government, you go to a meeting where you have government staff, right? You collect their numbers. Don't just take their numbers. Drop an SMS, right? Make a call. There is a celebration. Send them good wishes, right? Those relationships would help you. There are some relationships I've built in my first job, right? That in my later job, they were helpful, right? And then also, in engaging stakeholders, networks like this, the EA community is very important. Like there's something that happens at my workplace. It happens like a miracle, but it's not really a miracle, right? Now, so sometimes I want to move to another country, right? And my ED will like, oh, I'm looking for someone in that country. And I'll say, I'll get you someone, right? And I put up a call. You know what I do? I'm a member of the Mandela Washington Fellowship Program. And in each African country, there is a fellow, right? So all I need to do is to call someone in that country, right? Now I'm part of the EA community. All I need to do is to call someone in that country, right? So relationship management is really very important. So as you come to a meeting like this, build those relationships, keep them, because they might know someone in government. Abdul is here, right? He's helping us with Tanzania, right? And also, it's also important to have people who understand the local context. I want to call up my colleague, Hadia, right? Hadia, if you're here, please stand up. Hadia just stopped working with us. His contract ended a few days ago. He has been very helpful in northern Nigeria, right? I'm talking about a consultant to recommend. If you are going up north, maybe you look towards Hadia's way. She knows how to navigate and get, and this having the right person in your team is very, very important. And it's something that as you're here in the hall, begin to build your expertise in stakeholder engagement, because irrespective of the high impact work you're doing, you need to engage stakeholders, be it government, others working in this space. This is one skill set for those who are looking to excel in public health you might build. But this robust stakeholder engagement is very important after you've done your landscape analysis and stakeholder mapping. Then the other important things we did that is very important is co-creation. Now, most high impact work, there is this tendency and temptation to prepare an already cooked meal and present it to government, right? But sometimes you might succeed, but sometimes you don't have a very lasting success, because when people do not co-create an initiative, right, they would not own it as much as you want, right? So it's important that when you're engaging with government, when you're starting up, please co-create with them. There's a lot of knowledge they have. You might look at them as, oh, they are civil servants, they don't know much, but they understand the context. That project, they've seen it done by so many high-impact organizations. So please co-create with them. And it's also important, as we did in our own work, government will review before giving you approvals. And obviously, you know, most people know the importance of approval in Nigeria and even other African countries I've worked in. if you don't get government approval, engaging healthcare workers might be very problematic. You might go to a PHC to carry out whether it's a research or you want to start your program. What they'll ask you is, where is the letter from the government, right? So approvals are very important. And for the work we do, accreditation is important. You need to keep people motivated, right? One of the ways is if, in addition to getting knowledge, they will get the CPD points, right? Sometimes, especially this is something that happens in advocacy, most times you think that if you're doing something right, you're doing something that is good or saves life, that people will jump on it. No, that's not how humans are wired, right? You might be doing something good. You might be telling someone this is the right way to go, right? But you don't expect that everybody will jump, right? So it's always important to also find a way to motivate your target group. Then having established a relationship with government, it doesn't stop there. You need to sustain that relationship. And what are some of the steps? You have to continue the engagement. It's not one-off. Continue, right? The other important thing is that you need to provide intermittent updates. For some of us that work in Nigeria, you hear this common phrase, you have not been carrying us along, right? Carrying people along in government means you're not providing updates, right? So for you to sustain government engagement partnership, right, you must provide intermittent updates. You can make this monthly, quarterly, or twice a year, right? And also, continuous engagement and updates can take various forms. Continuous engagement by maybe you're a member of the technical working group, right? Or you attend an event by government that relates to your work you do. By such interactions and meetings, you're able to meet with government partners, greet them, give them an update of what you're doing. You can have a discussion over lunch and provide such updates. So it can take various forms. And then as you continue to work with government, you need to try and keep aligning with government priorities. It keeps changing. Recently, with the new minister, we start hearing words like SWAP, right? Nigerian Health Sector Renewal Initiative, right? But the good thing is that most times, when these priorities change, there is a way to adapt what you're currently doing to that context. But you have to be on a watch out for changing government priorities and find a way to align. And then you have to think sustainably, right? Because most of the high impact work we do, for us to sustain it, we need to think how government will eventually take it up and run by it, right? So it's important that you begin to sustain your relationship and engagement with government. You're thinking of, how do I get government to take this up? And you have to be empathic. You don't think that because something is good, government will take it up. You need to understand, do they have the physical space to take it up, right? Do they have the capacity, right? You need to build people's capacity, right? So these are kind of important points I think I need to highlight in sustaining government relationships. So thank you all for listening. I hope that you've learned a little things about how to engage government and how to sustain those relationships. Thank you very much.
Please keep clapping for Dr. Obinna. Thank you very much. And now we'll move on to Q&A. I think some questions have come in, and you can keep sending your questions on Swap Card while we start. One popular question as of now is perception management. People want to know, how do you, at least practically, what did you do to manage perception so they don't feel like you're coming there on your high horse with your funding and knowledge?
Yeah, so I think it's important to, first of all, pass the right knowledge, and you need to be respectful in your communication with government, right? So information gap can build wrong perception, right? So when you're engaging with government, try as much as possible to break down what you want to do. So you're starting a new program in the States. How do you break it down in a way that they understand, right? When you're preparing for an engagement with government, also you have to anticipate what are the potential questions, right? One of the common questions when you engage government is, what is the need for us, right? They might not be very, very direct with it, right? So it's also important that when you're engaging government, you understand how to get them involved, right? You are not to, they don't need to benefit from that project because it's targeting, maybe you're targeting people in the community, right? But you must find a way to say, okay, how do you get them involved? Even things like co-creating the process, right? Having review meetings, right? They will feel empowered. They will feel that they are part of the process. So in terms of creating the right perception, what's important is provide that information, right? upfront. Research about possible questions they will ask. I've given you an expo. One of them is they always ask you, what is in it for us? How can we benefit, right? And then also, sometimes, something that have helped me is that always think of more than the financial benefits, right, of a program to government, right? Most times, over time, government forgets that it is their role to provide services. It is their role to build the capacity of healthcare workers, right? So sometimes when they ask you, what is in it for us, you then take them back to say, this is something you should be doing, right? Or you might not say that way. You can say that, okay, let me give an example, that this service, we're providing it free of charge. Your people are going to get CPD points. That would help them. Sometimes you also try to put a little peer pressure, right? One thing that worked for me is that I will tell you how Kano, Bauchi, Gombe, and Adamawa is doing it, have adopted it, and your healthcare workers need to benefit from it, right? So most times, governments, they fall for peer pressure. Once you tell them how other states have adopted it, and you've not adopted it, they will jump at it. Thank you.
Awesome.